So Hannah, what do you know about the patient we're going to see today?
Okay. Well, Kiara's got a referral here from her GP. It's a bit brief, so there's not a lot of details. However, Kiara's a 12-year-old girl with diplegic cerebral palsy, which means that both of her legs are affected. Kiara was born quite prematurely at 29 weeks gestation with bilateral grade 3 interventricular hemorrhages. She's been referred to us today for parental concerns regarding deterioration in her gait and some leg pain, which reportedly started approximately 3 weeks ago. The GP reports that the plain film lower leg x-rays didn't show any fractures and there was no history of any traumatic injuries. So she's had some orthopedic surgery on her hips at 8 years of age and a squint repaired on her eyes at about 2 years of age. So for now, that's all the information that I've got because she hasn't been on our service prior to this investigation and there's no other medical records I could review before seeing her.
Sure. What details we need to gain from the subjective assessment then?
I'd like to get a more thorough understanding of the current problem, what her symptoms are, what aggravates and eases them, and how it's affecting her participation in daily activities, such as participation at school and participation at home activities. I want to find out what equipment she's currently using, such as maybe AFOs and how they're going. I'd also need to ask further details about medical, surgical and developmental history, as well as any other medication she's taking. I would ask whether she's had any previous input with physiotherapy or health professionals through other services. Also, I want to ask about her social network, and then once I've done my subjective assessment, I'd like to discuss the treatment plan with you and we can go from there. Is that okay?
That's great. Let's bring Kiara in. Her parents have given consent for a physiotherapy student assessment today.
Hi, Kiara, is it?
Yes.
Hi, my name's Hannah and I'm a physiotherapy student that's going to be having a look at you today. And you must be Kiara's mum.
Yes, hi, Alex.
Hi. And this is my educator. You've met Richelle.
Hi.
Hi, Richelle.
So Kiara, I just understand you've been having some pain in your legs, is that right?
Yeah, I've had a lot lately.
Okay. Well, first of all, I just quickly ask, are you okay with sitting on the bed? You don't need a chair or anything?
No? Okay.
Okay. I'm just going to ask Mum a quick question and then we'll come back and we'll talk about some more of your pain, okay? Okay. So Alex, I've just read in the GP referral that we don't have like a lot of information about the history and everything. So I'm just going to have to ask a fair few more questions today just so that we make sure we cover everything.
Yeah, that's fine.
Yeah.
They've just moved to the area, so
Okay.
there probably won't be a lot of notes transferred over yet
No
from
worries.
the GP.
So you've just moved here. So about how far away have you moved from?
About 2 hours away,
2
so we
hours.
moved about 6 weeks ago and we've just had to come for work reasons.
Okay.
Yeah.
Okay. Well, that's great. So let's get started. So Kiara, can you tell me what problems you've been having with your legs at the moment?
They just really hurt around my ankles.
They really hurt?
And where the bony bits are in my AFOs, they get red marks and everything.
Mm-hmm. And does one leg hurt more than the other?
No, they're just about as equal.
They're just about as equal? Okay. And I'm going to give you some faces. Now, can you just tell me, point to which face the pain feels like?
I'm not sure, Mum.
Have a go. Just find one that, look at the faces here and see which one you think.
That one? Okay. And do your legs hurt all the time or just sometimes?
Yeah, they hurt most of the time, only when I'm walking.
Okay.
Yeah, it's mostly when she's walking. She's definitely not walking as far as she usually does.
Okay. And how far can you usually walk before they start to hurt?
To the end of the street, maybe.
End of the street?
Yeah, probably about 100 metres. We need to use the wheelchair a lot more.
Mm-hmm. And are you waking up in the middle of the night with any pain at all?
No.
No? Okay,
No,
that's
she
good.
seems to sleep through.
Yeah.
Alright. And do you have any funny feelings in your legs, like any pins and needles, numbing feeling? No? Alright, well that's good. And so Kiara, what do you do when your legs start to hurt?
Well, normally what happens is I just sit down for 10 minutes.
You sit down for 10 minutes?
We've tried some massage, but that doesn't really help, does
It
it?
definitely doesn't.
No,
Okay.
and if the pain's not going away with sitting down, we just use some Panadol and Nurofen.
Yeah. Okay. And are your legs, is there any other pain? So like in your back or in your hips or anything?
In my back, only sometimes it hurts there.
Okay.
It's mostly just your legs though, isn't it? Yeah.
And Alex, just quickly, is there any other symptoms or things that you've noticed that you're worried or concerned about?
No, I don't think so.
No? Okay. And was there anything that happened prior to Kiara's pain? So like a fall or any change in her exercise levels or anything new that happened?
No.
No? Okay. So I've got the GP referral and he's mentioned that she's had some x-rays done. There were no fractures or anything, which is good. Was there any other investigations that Kiara had done within the last couple of months?
No, it's just those x-rays and they don't seem to have any concerns about that at all. Yeah.
Okay. And I understand you had an operation on your leg when you were about 8, is that right?
Yeah, it was really scary. It was my first one, and
You were very brave. Yeah. The orthopaedic doctors, they cut her thigh bones and turned them outwards and then put them all back together.
and put some plates in.
Yeah.
Okay.
And then the plates came out about a year later.
And then I also understand that she's had a squint repaired when she was about 2.
Yeah, that's about it though. So
Yep.
she's just had the eye surgery and considering how little she was when she was born, we've been pretty lucky.
You must have been real little when you were born, right?
Yeah.
And was there any other things that you were concerned about, like when she was born, all of her general health, hearing and vision, that was all good?
Yeah, that was all good. She did have some hydrocephalus when she was younger, so we were monitoring that for quite some time, but we didn't need to have a shunt put in.
Cool, okay, yep, no worries. And Kiara, are you on any other medications at all?
No, just Panadol.
Just Panadol? Okay.
Sometimes Movicol if she gets a bit constipated.
No.
That's okay. I have to ask some more questions though about going to the toilet. Do you all good by yourself?
Yeah, I can do that fine by myself.
Yeah? And what about getting dressed and having a shower and that kind of thing?
I only need somebody to help me when I need to put my pants on or in the shower.
In the shower? Okay. So that sounds like you're pretty clever. Now let's talk about your AFOs. So how long have you had them?
I'm not sure about a year.
Yeah, probably closer to about 4 months. Yeah.
Okay. Well, we'll talk about that a little bit more in a minute, but are your AFOs, are they fitting okay?
I think they're the worst pair I've had.
Okay.
Yeah.
And they're really sore.
So we've only had them about 4 months. We got them when we went up to the kids' hospital to have her hips x-rayed, and that's when she also got some Botox put into her muscles as well.
Okay.
I hate the needles.
Do you?
Yeah, and it's getting much harder to put the AFOs on.
Yeah. Okay. Well, we'll definitely have a look at that today.
Okay.
Now, when you go to the children's hospital, who do you see when you go there?
Pretty much everyone, hey?
Yeah, everyone.
Everyone?
It just takes forever.
It does.
Ever.
We have to travel a fair distance, so they try and get everyone coordinated for the same day. So we see the bone doctor and the eye doctor and the rehab doctor, the orthotist if we need our AFOs changed, the physio if we need her.
Yeah.
Yeah, I think that's about everyone.
Okay. So you were there about 4 months ago, and so which muscles did you have the Botox toxin injected into?
My calf.
Your calf, okay.
Yeah, her hamstrings as well. We usually need a little bit more on the left-hand side.
Yep.
Yeah.
And how often do you have those injections?
6 to 4 months.
It just depends.
Yeah.
It depends on how she's going. Usually every 6 to 9 months or so. We're not due back there for about another 3 months for a review.
Okay.
Yeah.
And tell me about school. What grade are you in?
I'm in grade 6 and I'm really loving it.
Yeah? That's good. And do you need any help when you're at school?
I have to have somebody with me because when I have to use my walker at school because of the unbalanced ground, I'm more likely to fall over.
Okay.
She's got a PI verification
Okay.
at school, so she gets a bit of physical assistance around the school grounds, and on her IEP they do every 6 months. They've identified she needs a bit of help for maths in the classroom.
Yeah, maths is really hard.
Yeah.
It is a bit hard.
You try
isn't it?
really hard though.
Yeah.
And I understand you have a walker. Yeah?
Yeah.
How long have you had the walking frame for?
I'm not sure.
The one she's on now it's probably about a year old. She got it in grade 5, but she's been using a frame since she started walking when she was 3.
Mm-hmm. And do you have to use the walking frame when you're at school?
Yeah, because of the uneven ground.
Yeah.
And
She can usually manage a few metres inside the classroom or at home if she's got some furniture that she can use to balance herself. But if we have to go out to the shops or to her brother's soccer, we need to take the walker with us.
Well, it sounds like you're very out and about with everyone in the family. Do you have any brothers and sisters?
yeah, I have a little brother, but he's really annoying. And
Yeah.
I have a big sister, and we just love playing with our dog Ralphie.
You have a puppy.
Yeah.
That's cool. So you've got a brother, a sister, and you've got a puppy.
Yeah.
Yeah. And so today I just want to find out what goals you'd hope to achieve, the both of you, by coming to see us.
The main goal is to be able to let my legs stop hurting
Mhm.
because
Yeah.
it's just affecting me so much.
Okay.
Yeah, that would be probably our main goal, is to see what we can do about the pain,
Sure.
and also if we can get you back to doing your normal walking. Hey?
Mhm.
Yeah.
So in regards to the walking, so you've mentioned that you haven't really been able to even walk to the end of the street and back.
Mhm.
So how would Kiara usually manage in the walker?
So in the afternoons we walk Ralphie,
Okay.
don't we?
Yeah.
So that's usually about 3 blocks. That would be 800 metres. How far do you reckon you get at the moment? End of the street, 100 metres. Yeah.
Okay. Well, it sounds like your leg pain's really restricting that movement there.
Yeah.
So we'll definitely make sure to have a look at that.
Mhm.
And then with your walking still, do you feel like you're tripping over or feeling a bit unbalanced at the moment?
a lot.
Yeah? Okay. Well, we'll have a good look at that today and we'll see if we can help with all of that. So I'm just going to step outside quickly with my educator, Richelle, and we're going to talk about the next assessment to try and stop that pain.
Okay.
I see you've got my iPad back. Do you think you can have a go at beating? I usually play that game. Do you think you can beat my score? I'm
Yeah.
on level 7.
Cool.
Yeah?
We'll give that a
Okay.
go, hey? Yeah.
Well, we'll be back in a moment.
All right.
No.
See you soon. Okay, Hannah, what are the important things you found from your subjective assessment today?
Well, I now know that Kiara would be a GMFCS 3 and her FMS would be a 4, a 2 and a 2 from our discussion about her mobility. She's well linked in with the appropriate hospital services for her needs, and there are no other current medical concerns that are of significance, and I didn't identify any red flags in my questioning. The main concern is her pain and reduced walking, as well as her endurance, and this is affecting her participation with her physical activities with her family. She's had some derotation osteotomies on both of her femurs about 4 years ago, so she's likely had a lot of internal rotation with her gait prior to this. She also has regular botulinum toxin injections, the last being 4 months ago. So from the research I've done on this, I would expect that it would still be clinically effective in reducing her spasticity.
So do you have any differential diagnoses at this stage to help guide your objective assessment?
Well, as I said, the botulinum toxin should still be having some effect on her muscles, but she may be in pain if this is worn off and she might have a lot of spasticity. If her AFOs aren't fitting well, then she may have had a growth spurt in the last couple of months and her calves may be contracted.
So what do you want to assess objectively today?
I think it's important to do a neuromusculoskeletal exam, including her muscle power, clonus, and spasticity assessment, as well as looking at her range of motion in her lower limbs, especially her calves.
That sounds like a good plan. Let's go back and see Kiara.
Okay, Kiara, so we're just going to have a look at you walking now. So we'll go out to the corridor and do that. I've set up a video camera that we can kind of use as just a baseline to gauge how you're walking and track your progress. So I've got a consent form back in my office that you'll need to have a look at just when we're done, if that's all okay with everyone.
That's fine.
Yep, it's all good. All right, we'll go and have a look at that now.
So what are you seeing there, Heather?
She's a little bit hunched, so I might just adjust the walker.
Sounds good.
So Kiara, I'm just going to adjust the walker for you, if that's okay. Okay, let's have another go now that it's adjusted and see if that's a little bit better. Okay, Kiara, so I'm just going to have a look at your airfoes now, if that's okay?
Yeah.
Yeah? Alright. Okay. Hey, can you just take your airfoes and socks off for me?
Sure.
And I'm just going to have a look at your feet. Okay. So they're a little bit red. How long have you had the AFOs on today for?
Around 3 hours from this morning when I was getting dressed.
Right, around 3 hours. And is this where they're hurting? Just up the backs here?
Yeah.
Yeah? Okay. Right. So we're going to see how strong your muscles are now. So if you want to lie down for me, I'm just going to do some stretching of your muscles, okay? Would you be able to adjust the bed for me?
Sure.
Thank you. Okay, Kiara, and are you comfortable where you are?
Yeah.
Okay. If I could just get you to help me with her legs.
Sure.
So
Just let me
hold that one.
No
So what I'm
worries.
going to do now is I'm going to stretch your muscles. So I want you to relax and just lay still. And what we're going to do is just let me know if it feels a bit too stretchy. Okay. So hold it there for me.
Sure.
Just back a bit. Okay. And now we'll do your ankle. Does that hurt? No? Sorry. Alright. And now we're just going to do your hips, okay? So what we've found is that Kiara's got very tight muscles in her calves and in her hamstrings. And this is what we think is causing the airfoes to rub a little bit, especially on, your heels and your ankles. Have you noticed if Kiara's had a growth spurt recently?
Well, we've changed schools, so we've got new uniforms, so I haven't noticed that. But when we went out on the weekend, her jeans were a bit shorter, weren't they, on your legs?
Yeah.
Yeah.
Yeah, I think that's also why her walk is a little bit shorter as well.
Right.
So what happens is when a kid has a growth spurt, usually the bones will grow first and then the muscles have to catch up. And so this is a little bit trickier when the muscles are a little bit shorter or tighter normally. And when there's also spasticity in the muscles as well.
I might go as tall as you, Mum.
We'll see.
I think it would help if we could improve Kiara's ankle range. We can do that by stretching the muscle over a few weeks.
Okay.
Serial casting, have you heard of that before?
Yep.
That's been known to show the best results in stretching a muscle.
Ooh, can I choose the colour?
You can. Have you had problems with serial casting in the past?
No, not usually. Hey, we did have that one time where it got wet and she got a rash on her legs, but usually it's no dramas at all.
Okay, good. Well, we'll do the casting over a number of weeks and monitor the changes in Kiara's muscles and how it's affecting the progress. So we'll change the cast regularly, probably each week, and that way we can also keep an eye on your skin and make sure that no breakdowns or no blisters develop. So does that sound okay with you?
Yep, that's okay.
Yep.
Yeah, we could probably manage a series now, couldn't we?
You could get started today. Is that a possibility?
Yeah, I think so.
Yep. Okay.
Luckily, we're doing swimming until next week.
Yeah, that is lucky.
Next week or next term?
Next term.
Yeah.
Next term? Okay. Well, we'll also give you some leg wraps that you can use for your other leg. So for your hamstrings, you can usually do those. They're a bit fun to do in front of the TV when you're watching your favourite TV show after school. Do you think you could do that? Yeah? Okay. Well, if you're happy, if you're both happy, we'll make a contact to the physiotherapists that you see at the Children's Hospital and just let them know what our plan is, let them know what's going on and everything. And we can take it from there if you're happy with that.
Yeah, that sounds fine.
Yeah? Okay, so what I'll do is we'll go and get that started today then.
Sounds good.
Okay,